talk about grief, grieving what was, and also embracing what is. It is my honor to introduce the next speaker, Holly Gainsboro, who is the founder of Golden Heart Grief Support and Education. She is also a certified grief coach. That is her professional world. But personally, Holly's late husband, Stephen, passed away December 2010 from glioblastoma. Her depth of understanding brain tumors and their effects on the patients and the caregivers enables her to be fully present with those that she communicates with and those that she helps. I'm excited for her presentation. Let's welcome Holly.
Okay, you guys can hear me? Thank you. Yeah, thank you. Yes, the only thing I was nervous about, because I love public speaking, give me a stage, give me a microphone, I'm all up in it, is this thing, is the slides. So we'll just hope for the best, you guys. I gotta tell you that I don't know how you follow a brilliant, well-known neurosurgeon who talks about poop and mice and then segue right into grief, but we're gonna try, you guys. I want to thank the ABTA and their staff, not only for this conference, and it is phenomenal, but for introducing the subject of grief. It's something we don't talk about enough. In fact, sometimes it's something we don't talk about at all. It is dismissed and it is swept under the rug. So thank you for bringing me in and doing this, because today we are going to talk about grief. And we're going to talk about all sorts of things about grief. But first, that's a really big picture of my family. That picture was taken 16 years ago this November. Those are our children, Derek and Liana. Derek is now 32, recently engaged, and Liana is 28 and likes to make fun of me because I'm a boomer and couldn't do my own slide deck. I won't tell you what I say to her when she speaks to me that way, but we're very close. And that is my Stephen, the love of my life, my whole heart, my home. Stephen was diagnosed February 12th, 2009. There are some dates we never forget. Diagnosis Day is one of them. Raise your hand if you remember Diagnosis Day. Yeah. That's the day I started grieving. But here's the thing, guys. I didn't know I was grieving because nobody taught me about grief. I knew about loss. I knew about death loss. But I also knew in my family, we didn't talk about that. There were some tears, but that was it. So there I am with this amazing man diagnosed with glioblastoma. Now, I don't know about you, but when we went to the neurosurgeon, and we were told it was a cyst or an abscess, so there goes that. And he said, oh no, you have blah, 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 blastoma. I have no idea what you just said, right? Try and pronounce that for the first time. And of course, if you know me, you're not gonna be surprised when I say this to you. I looked at the doctor, I said, oh no, it isn't. It's an abscess or a cyst. Like I know. I was wrong. So February 12th, 2009 started our journey. I want to share something about my husband. Now, while he has died, and it'll be 15 years this December, and I have since remarried, by the way, to a widower, who's the one who encouraged me to do this work, this grief work. This man will always be my husband, and I will always be his wife. I think somebody may have talked about the Maury Schwartz book yesterday, Tuesdays with Maury. I don't know if that came up. It came up in a conversation with somebody else a couple of days ago. And there's a great quote from that book. Death ends a life, not a relationship. So my relationship with Stephen is ongoing. The day of his diagnosis, we were blindsided like anybody here who was either the person diagnosed or the family member care partner. And he said something to me about our children, Because the first thing I said was, what are we going to tell our kids? How do I tell our children this? I imagine many of you have had that feeling. How do we tell the people we love? And Stephen looked at me in all his wisdom, and I have to preface this. Stephen was like that guy in Charlie Brown that had the cloud over his head, was waiting for the shoe to drop. That was my Stephen. He got a brain tumor, and I was like, the essence of his beautiful soul came right out. And he said, Holly, our children are going to become more compassionate and more understanding in this experience. Wow. I said, who are you? What have you done with my husband? Beautiful man. So we had 22 months together as he lived with glioblastoma. And when he died, and I will never say, and I want you to hear this, I will never say he lost his battle. How many of you heard that expression? Oh, they lost their battle. You see it posted in social media. They lost their battle. Oh, they lost their battle. This was not a sporting event for us. This was not a baseball game to lose. His journey ended. He died. And so I honor him best by being with you today. I honor the journey we traveled for 22 months, and I will tell you that man who complained for every day we were married until he was diagnosed with a brain tumor, never complained. Every day, and that was our journey. It doesn't have to be yours, but that was ours. Never complained. And so I honor him by doing this work, because this family and what this family went through with this amazing man will never be for nothing. So that's my story. And now let's see how I do. Look at me. Thank you. Thank you so much. Okay, disclosures, blah, 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 blah. Okay. So what is grief? You can read all of that. I don't need to read all of it to you. The biggest thing about grief is it's change. And it's usually change you do not want. Change in what you're used to, change in your lifestyle. It can be death or non-death loss. You heard me talk about my grief started on February 12, 2009. And when we get to the next slide, we'll talk about what that grief really was. There are feelings that we can have that can be very conflicting. I'll give you an example. When Stephen died, and he died at home, because that's how our kids wanted it. They were 13 and 17 when he died. And we woke up, he had died. And our daughter Liana, who was 13, said, "Is it bad that I feel relieved?" Now, I hadn't started doing this work, but intuitively, I knew it wasn't bad. It didn't mean she wasn't heartbroken. It didn't mean she wasn't sad. But dang, this was a hard journey for my kids. It's conflicting feelings caused by the end of our change in what we're familiar with. She was sad and she was relieved, and that's okay. And I want you all to know that. You can see also, grief is the normal response to loss, whatever that loss is. Grief is not something we get over, and we're not supposed to get over. We can grow around it. It softens. So you can see all the different, you can take a screenshot of it if you want. Does anybody have any questions about the definitions of grief, or want to add a definition? Because your grief is yours. Yeah, I'm a grief expert, but you're an expert on your own grief. And grief is as individual as your fingerprints and as unique as your relationships with the loved ones that are with you or have died. So let's talk about the grief that I experienced. And maybe you've heard of this. How many of you have heard of anticipatory grief? Okay. Wow, that's a lot. I can't tell you people I talk to have never heard of this, and I never knew that was such a thing. Some people are uncomfortable with the word anticipatory grief because what they hear is, I'm anticipating my person's death. And that's uncomfortable. I have a client a young woman, and she is her mother's primary caregiver. She's only 24 years old. And when I said, you're in anticipatory grief, she said, I don't want to be in it. I don't want that. I don't want to anticipate my mother's death. And I said, okay, hold on. Let's back this up a little bit. And you can read all the different types of things that would cause anticipatory grief and what it really means. It's anticipation, not necessarily anticipation of a death, but anticipation of where you are on this journey with the diagnosis, whether you're a patient or you're a family member or the care partner. Anticipation of what is life going to look like now? What do I do with this information? What are the changes I'm going to experience if you're a patient? What are the changes I'm going to experience in my world, in my cognitive abilities, with my treatment options? And for a loved one or care partner, what is my relationship going to look like? What's my role now? Who do I get to be and who do I have to be? Two different things. So if you look, you'll see, and I'm going to look down quickly, the uncertainty. Birthdays. I love this one because I always see this with clients and in the groups that I facilitate when there's an anniversary date coming up, whether it's diagnosis date or if it's a death anniversary. I call them angelversaries. Birthdays, wedding anniversaries. As I mentioned, Derek is engaged and he's getting married in April. There's some anticipatory grief for me there because Stephen won't be with me. I'll have my family with me. I have my husband, Joe, who is a light in my life during some dark times, and I for him as well. But there's some anticipatory grief as I anticipate that day, the day of the wedding. And I like to share my own experiences because I think it's helpful. It makes me real, that you know I see you, and in some ways I am you. So I hear from people in my groups, and they'll say, you know, my loved one's birthday is coming up, and I do grief groups, grief support groups. And sometimes the lead up is harder than the actual date. I see you nodding, Erica. Kim. Yeah, sometimes it's like, we get ourselves worked up, and that's okay. It's part of the grief. It's just sort of a grief burst, as I like to call them. And that's really normal, whatever normal means. How many of you have heard the expression, oh, it's your new normal? Thank you for laughing. No, I'm in my new normal. This is a new normal. People will tell you, oh, well, this is just your new normal. It's normal for you to feel that way. And yeah, it is. You know, in the last slide when I said grief is the normal response to loss, what you're experiencing and feeling is normal. But here's what it isn't. It's not that normal when it's new for you. When it's your experience, it doesn't feel, this is not the normal you want, right? This is not the club you wanted to join. I joke around saying, I thought I was joining the club with the swimming pool and the tennis courts, but I wasn't. So that's a little bit about anticipatory grief. Again, you can take screenshots of the screen, so I don't want to read off of the screen. Before I continue, I'm going to pause. Any questions or comments or stories you want to share about your own experience or wonderings about anticipatory grief or feelings about that word, anticipatory? Don't be shy. Okay. We'll go on. I'm so proud of myself. We're going on to the next one. Oh, there is one. I'll go back. Let me go back. Wait, can I go back? Oh, I did it, you guys. I'm having the best time.
Can you hear me? Okay, great. My question on anticipatory grief is, how do you manage it? So trying to be present in your journey and with your patient survivor as a caregiver, perhaps. How do you manage it?
That's a great question. What is your name?
My name's Karma.
Karma?
Yes.
Nice to meet you. What a great name.
Thank you.
Here's what I'm going to say, Karma, and everybody. Grief isn't something you need to manage. It's something you just get to feel and sit with. So when you're experiencing that anticipatory grief, the wondering, some of the fears, some of this, sometimes it's a feeling of helplessness. Let yourself be there. We try so hard because we are a grief illiterate society. So I am here and ABTA is here to normalize it for you today and all your tomorrows. We're told to stuff our feelings. And so that's where the word managing, how do I manage this? People may say, oh, you need to manage this. It's not a business transaction. Grief is not logical. Grief is emotional. And our emotions need and deserve to be felt and experienced. So when you're feeling it, Karma, feel it. Be curious about it. Be a gentle witness of your own feelings. Do some writing. I'm very big on writing. If you're not a journaler, people say, oh, I don't want to journal, I don't journal. You don't have to journal. You can write 3 words. Write a haiku. Whatever works for you. But write down all those feelings and thoughts that are coming to you. Draw if you don't like to write. Get outside in nature. Drop into your body. Because a lot of the times the managing and those words that we come up with, it's up here. Drop into here. Take a breath. I'll do that for a second. Drop into your body. Drop into your heart. And just notice where you're feeling it. Where are you feeling the anticipatory grief? Where are you feeling the fear and the uncertainties? And put your hands there. If it's your heart, put your hands there. Say, okay, I'm okay. I'm okay, I'm safe. If it's in your belly, right, your solar plexus, we hold a lot of stuff there. Put your hands there. If it's your shoulders, put your hands up there and send love to those areas. And give yourself permission. I give myself permission to feel this grief. I give myself permission to feel uncertain. I give myself permission to be scared. I give myself permission to be angry. That's okay. Is that helpful, Karma? Okay, thank you. Anybody else before I go on to the next one? Before I push my green arrow that I love so much now? And I'm talking more about that than about grief. Okay, how many of you have heard of the stages of grief? Woo! So if I use a whiteboard, sometimes I'll do whiteboards or chalkboards with people when I do this, and I'll write them down as we're talking. And then I put an X through it and I write BS. Now don't go there, children. Belief system. I knew what you were thinking. Belief system. We've been fed this belief system about the 5 stages of grief. So here's what I want you to know. Elizabeth Kubler-Ross, a brilliant grief expert, brilliant in the field of grief. She developed these, did her research, denial, anger, bargaining, depression, acceptance, for those who are diagnosed with a terminal illness. It was not intended for those who are grieving the death of a loved one. But she found that there may have been some similarities. This is where a lot of grief experts like myself think that she may have got it a little wrong. Again, brilliant, so I will never put down any work she's done, because nobody else was doing this when we needed it. So when you look at that, denial, anger, bargaining, depression, acceptance, I want you to think of it as being more descriptive. It's a description. It's not a prescription. You don't have to adhere to it, because here's the deal. Anybody who's grieving, we're all grieving something. Every single person in this room is grieving something, including medical professionals who grieve for their patients. And those are the forgotten grievers, aren't they, Dr. Dunbar? Yeah. So when you look at that, we know for sure that grief isn't linear. It's not this straight line. We go, oh, okay, I'm in denial now. I can't wait to get to acceptance. Woo. All right, I'm there. Okay, done. Woo. All right, my talk's over. Now I can be done. Right? But no. Grief is messy. Grief is uncomfortable. Grief is all over the place. And maybe you will experience one or some or all of these. And maybe you'll experience none of them. I had a client once that we did an exercise on the stages of grief. And when she was told that they really aren't meant for people who are grieving a death, that it's for the patient, I cannot tell you the relief that just surrounded her, because she thought she was grieving wrong. She goes, I don't feel angry. I don't feel like I'm bargaining. I know that he died. I'm not in denial. So I found this tangled ball of grief. This was created by H. Norman Wright, who is a grief therapist. I love this graphic except for, you know what I'm going to say, right? The word denial in the middle. I'm not digging that, but it's the only one I could find, and I feel like it wouldn't be right if I blocked it out or had my daughter block it out for me. Again, boomer. Because I took it from the website. What I would love to do with that word denial and do a reframing, I actually have a podcast and we did a whole episode on the stages of grief and a reframing of it. I would rather take the word denial out and put in disbelief. Listen, when somebody dies, we know they're dead. And you will never hear me say anything but died or dead. If you're not comfortable with those words, you don't need to ever use them. You use the terminology that works best for you. It's what I do because of my field. That's my normalization of it. Disbelief is, Stephen will be gone 15 years in December, right? There are times like, I really can't believe I'm never going to see him again. Like, I can't believe he's gone. That doesn't mean I'm feeling the heaviness and the weight of it. It's just like, wow. So I like the word disbelief better than denial. That's just for me. You use whatever words you want to use. But if you look at the ball of grief, there's all these different emotions. Dread, rage, sadness, fear, loneliness. All of that is just in this big ball of yarn of grief. So I want you to recognize for yourselves and other people that grief is so, again, individual, but it's not linear. So if somebody's saying to you, oh, well, you're in the anger stage. Thank you very much. I'm just grieving. Hard stop. You don't have to be in any specific place with it. There's ups and downs and highs and lows. Any questions or comments about that and the stages? See, if I was talking about medical stuff like Dr. Lim and poop, you'd all be, thanks a lot. You'd all be yakking up a storm. But that's okay. It's okay. I'm good. It's fine. I'm fine. Here's a great answer. I'm saying fine. I have a great acronym from you. How many of you have said to people, and they say, how are you doing? Yeah. I'm sorry. Like, how are you doing? How are you? How are you? People mean so well, don't they? And they're so misinformed. Oh, God bless them. Fine. I'm fine. I'm fine. I'm fine. It's fine. Feelings inside, not expressed. Because sometimes we're not going to express those feelings. Find your safe people that you can. Yeah. Right, ready? Next one. Non-death losses. How many of you originally thought, like I did back in February 2009, that grief was really just about death? I know I did. But we have, thank you. Yeah, thank you, Dana. There are so many experiences we have in our lives that will result in a grief response. And remember, we'll go back to the definitions. I won't go backwards and go back and forth, even though I love this thing. Grief is the feelings caused by the end of or change in a familiar pattern of behavior, which means pretty much anything that goes on in your world. So a diagnosis is going to result in a grief response for the patient, for the families, friends, and care partners. And for the patient, there's grief, and also for the loved ones. But I'm going to talk to the patients right now because we have so many, and it's so awesome to see you all here. The grief of the life you planned for yourself, right? And for your loved ones, the dreams, hopes, and expectations of what life was going to look like, the path you were on. And then the path suddenly veers so drastically into a whole different direction. Grief of maybe not being able to work anymore. Cognitive changes, physical changes, changes in your independence. Aphasia. Stephen had some aphasia. Having difficulty talking. Having difficulty formulating your words and your thoughts, and yet you know what you're thinking and you want to say, and it doesn't come out the way you intend. Yeah. And for care partners, the grief of the responsibilities that are now on your shoulders. Becoming an advocate for your loved one, managing medications, managing appointments, making sure they're okay, that they're safe. As a care partner myself, and I caregiver and care partner are interchangeable to me. I was a partner in Stephen's care, and I gave him care. And I will tell you, and I want the patients here to hear this, because every caregiver I've ever spoken to has felt this way. No matter how hard the journey, and it can be, is truly, for me especially, I will speak for myself, was the greatest honor, besides having those 2 kids with him, the greatest honor of my life, to care for him and to love on him. Because it's not easy. This is not a journey for the faint of heart. But I know patients will feel, and this is a non-death loss, is that lack of dependence and being a burden. You don't have to raise your hand, patients. I don't want to put you on the spot like this, but just saying internally, how many of you feel sometimes or worry about becoming a burden? Stephen did. Stephen really, I see nods. Stephen absolutely did. So I'm here to tell you, the patients, you're not. You're not. It's an honor and a privilege. And it's probably, again, besides having our 2 children together, the most sacred time of my life. And I wouldn't change it for anything in the world. So some other non-death losses would be retirement. And this is non-brain tumor related. Sometimes, retirement can be certainly brain tumor related. Empty nesting. How many of you have kids and they've moved out, they've gone off to college, they've grown up? I know, right? Ashley, I know. I do a whole thing on this every year when college year starts for parents on Facebook and on Instagram. There's grief there when you're empty nesting. I gotta tell you, I've been an empty nester now a long time. My kids are 32 and 28. I have 2 inherited sons, and I have a grandchild now. And so my inherited sons are 33 and 29. And so Joe and I became empty nesters several years ago. And I've got to tell you, you get used to it and it rocks. They don't have a key to the house. They come visit, they have to ring the doorbell. We also move a lot, so they don't even know where we are half the time. But empty nesting is a big deal. And you'll hear from people will say, well, why are you sad? They're doing what they're supposed to be doing. They're supposed to go to college. They're supposed to get jobs. They're supposed to get all these things. They are. And grief is the feelings caused by the end of or change in a familiar pattern of behavior. Some changes are really good, but we can still feel that in our hearts, right? Yeah. Infertility. definitely something in the brain tumor community that is experienced and outside of the brain tumor community. When people are going through fertility treatments or have had miscarriages, we are in a society that does, I know they sweep it under the rug. Oh, you'll have more children. You'll get pregnant. All the stuff people say. Well-intentioned, misinformed. And changes in your relationship in the brain tumor community for brain tumor patients and their loved ones, changes in your relationships. Intimacy changes. Role reversal sometimes. Taking on added responsibilities like we talked about, communication. I don't know if any of you went to the hard conversations that City of Hope led yesterday. It was really, really good about having those conversations. And it is hard. Communication can be hard. And sometimes it's hard just because the patient has a hard time getting their words out and their thoughts. And then we feel like we need to be asking the hard questions, but maybe we don't. That came up yesterday about talking and having these hard conversations with people and asking them, how are you feeling? Especially if they're getting near end of life. How are you doing with this? And I've had many clients, and so I made a comment if you were in that room yesterday, because they talked about, ask the questions while you can. And I have clients who have said, I didn't ask. And I'll speak of one client in particular, this lovely young woman, everybody's young to me, but whose father died from glioblastoma. And she said, I never asked him how he felt about dying, how he felt about this journey. And she carried a lot of weight on that. Guilt. I love talking about guilt. We can do that too. And she carried a lot of that. And I said to her, client, was your father somebody who would emote normally, pre-brain tumor, during his brain tumor? She said, oh, absolutely not. No, absolutely not. He was an Italian macho guy from Jersey. Oh, God, no. So what would make you think he would have done it then? I said, would he have if you had asked? She said, no. I said, so who do you wish you had the conversation with him for? Was it for your father, or was it for you? It was for herself. She needed it. She thought she was not doing a beautiful service for him to have him talk about it. A man who would never have talked about it and never even talked about his diagnosis and was very private about it with her. He was a father. He was very protective of his daughter. I wasn't going to share that with her. But she needed it for herself. But she didn't know it till he was gone a few months. And folks, hindsight's an illusion. We can look back and question and wonder all we want, but we can create new narratives around it. If she didn't ask at the time, and she wasn't meant to, and that's okay. So for those of you who didn't get to have those conversations, I don't want you to beat yourselves up over it. It's okay, and you can still kind of have them. You know your loved ones better than anybody. What would your loved one want you to know? So if, with the non-death loss of communication, you find other ways to communicate, even after they're gone. Any questions, comments? All righty then. So we have an activity that we're going to do in just a minute, and it's called What Can I Control? And you have it on your tables, the handout. And you also have a handout that is a chapter I wrote for my husband Joe's book, Own Thy Grief. So take that home with you. So you have this control circle. So what's a control circle? When we're going through something, whether you're a patient or a loved one, there can be this sense of having no control. I do this with my clients. And we do it together. I meet with clients virtually, so I email it to them and they print it out. and I say, okay, what's in your control? And every single time I say this, every single client has said, nothing. I have control over nothing. I have no control. So we start really small. But I want to give you an example. When Jason spoke yesterday, and I love this, and I said, oh, I'm going to file this away. And you remember he talked about the first oncologist he saw who had a terrible bedside manner and said something awful to Becky as well. You know, what's your limit? And said to him, oh, you know, this is bad. Oh, my God. Should no neurosurgeon ever say ever, right? In his control circle, Jason could put, I control my choice of leaving this oncologist because he sucked, right? He was not a good doctor for him. Doesn't mean he wasn't a good doctor. He wasn't the right, I keep hitting this in my mouth. He wasn't the right doctor for him, and Jason took control. That would go in his control circle. I was talking to somebody this weekend, a patient, and talked about the control circle with them. And they said to me, you know what I have control over? My attitude. I said, yeah. But let's start really small. This is what I do with my clients. I start super, super small. Did you choose the outfit you're wearing today? Yes. Okay, so you have control over what you chose to wear today. Did you choose, and I hope you say yes, to brush your teeth today? Yes. I have control over brushing my teeth today. You see where I'm going? We start super small. We don't have to start with the big stuff. Start with the small stuff. I have control over what I'm going to eat today. Unless you're my husband, because then I give him a hard time about what he eats. I have control over what I'm going to read. I have control over how I'm going to respond. In this community, 90% of what happens with the diagnosis and what goes on and treatment options and everything else is not in our control. But how we respond to it is. How we show up. Who do we want to be? That's in our control. You don't have to control your emotions, but how you respond. So start thinking about, and just take a second and start thinking about, and if you want to raise your hand and share some of the things that you've come up with, I mean, I could go through a whole list, but I want to hear your list of what you have control over and noticing that. On the outside of the circle is what's not in your control. Diagnosis is not in your control. You didn't ask for it. You don't want it. But it's not in your control. If you're eligible for a clinical trial, or if your loved one is eligible for a clinical trial, it's not in your control. Insurance, oh gosh, insurance, right? All right, like really. Claims, getting back to you, all these other people who it feels like they have control over you, they don't, it's not in your control. So what's not in your control, put on the outside of the circle, and imagine what it would feel like to release that control. It's not yours. It's not yours to carry. It may irritate you. That's okay. But you can have control over how you respond to that irritation. You don't have control over what people say to you. Again, the well-intentioned misinformed. But you have control over how you respond to them. And I have lots of great responses for you that I'm happy to share. So let's see, what do we have in our control circle, folks? Now, don't be shy. Thank you, Dana.
Sorry. My big one is to be kind. Like, that's my number one mantra. If you carry that through in our society, it would be so nice.
Yeah, you have control over how you treat other people. I love that. That's beautiful, Dana. Thank you. Oh, somebody way in the back. Hi,
So
Carmen. Thank you, Carmen.
Thanks. So I can't always control my emotions, but I can engage in a daily reflection or gratitude practice, which can help steer my emotions.
Okay, you all hear that? Yeah. And you don't have to control your emotions, but, or and. I don't like the word but. Do you guys like the word but? I don't love the word and. You get to channel it in a different way, right? You get to be in your emotions and what you're going to do with them. Yeah. Thank you, Carmen. Appreciate that. Hi. What's your name?
Ted.
Ted?
Ted, yes.
Nice to meet you, Ted.
Pleasure. My control is never give up. Fight, fight, fight. Once you give up, you're already lost.
I love that. So that's Ted's control, to fight and to keep fighting and not give up. That's in your control. What else? No, he's coming to you. Yeah. Do you all hear her? Great. No, that's great.
Say it again for the virtual audience.
I feel like I'm in control of when I want to show affection, even if that couldn't be reciprocated from your loved one who is diagnosed, but I can still show it, and I don't lose that.
Yeah. That's beautiful. What is your name?
My name's Laura.
Laura, thank you so much. I love that, showing affection. We have control over how we, again, the kindness and treating people and loving on your person. Yeah. What else? Kristen, thank you.
I feel like under my control is who I choose to spend my time and energy with, because I have found that certain people in my life drain my energy and don't make me feel good about where I am in life. So I look to those who lift me up and inspire me, and that's a choice I make every day.
Thank you, Kristen. That's beautiful. And yes, and that's where I talked about earlier, finding your safe people. Finding the people who get to be invited into your journey. Friends do fall by the wayside. Sometimes family members do during the diagnosis time, during that time with your loved one or yourself as a patient. And it also happens when a loved one dies, and those who are grieving the death of a loved one, that people don't always know how to behave. There's a lot of fear there, and what to say. And so we need to find those people who can sit with us in the darkness, join us in the light, and not dismiss our feelings. So I love that. I love what everybody has shared in your control circle. What's something you cannot control? Hi, Erica.
Something that I cannot control is government funding.
Ah. That is so true. That's a great one, right?
I would love to. I'm trying.
We know that. We do know that.
Yes, I'm trying very hard. I'd love
you
to,
are.
but
You are. And
I
you know
cannot.
what? I'm going to stick you right on him, girl. I'm trying. That's great. Thank you. Thanks, Erica. Okay. So we are, disclaimer, blah, blah. Thank you. Thank you. So questions?
I think we just have time for one or two questions. I know that you interwove. Is that a word? Interspersed questions. And I have seen you that you've already been on the app active in
Okay,
people's
great.
questions,
So you
which
have
is
some questions
wonderful.
for me. Okay.
Are there any questions in the audience? Maybe we'll take one audience question and one virtual question.
And just general questions. Yes.
Yeah, general question. You have two circles. Mm-hmm. You know, and I think that gray area You could either give up control of certain things and let them go, or you could take control. So
Love that.
you can move that, some of the items out of your control into your control, and vice versa.
What is your name?
Paul.
Paul, that's great. Thank you so much. And I love that take on it. And here's the thing. You can do with this circle whatever you want because it's yours. So Paul's take on that is beautiful. I love that. Thank you for sharing that.
A virtual question is, this is from an 8-year GBM thriver. They would like to know, why do you think there isn't more focus on the emotional side of this path or this journey?
Well, like I said earlier, we're a grief illiterate society. We're uncomfortable, well, not me, but people are uncomfortable talking about the emotional side of it and talking about grief and going deeper into the emotion aspect of this disease. And there are so many emotions that everyone experiences with any illness. But listen, we all know it's the brain, right? It's the motherboard. And the brain tumor community is a very special community. But because of the fear of talking about it and inviting in the conversations about the sadness and about the grief and seeking out support, that's why. And this is why I do what I do. You can tell I'm super passionate about this, almost as much as I am about that clicker. But I'm very passionate about grief. I think it's important, which is why I became a grief educator, grief specialist, grief coach, because I want to normalize this. And I want to make sure everybody, especially in this room and watching, I see you. I feel you, I hear you, I witness you and where you are on your own personal journeys, and they are so personal.
Thank you, Holly, so much. I think we all kind of want to just put you in our pocket and bring you around with us.
Well, where do you live? Because I'm always getting, I said we move a lot, so I'm happy to go someplace different.
If you have any more questions for Holly, she also has an exhibit table out in the lobby, so please don't hesitate to stop by, chat with her. We do have a 25-minute break right now, I believe, if I'm reading the calendar or the agenda correctly. But right at 11:30, our breakout sessions will begin, and guess what? You have a choice of which one you attend. So go ahead and read up. There are 3 great options, and we'll see you in 25 minutes.
Thank you all so much.